Hi, Samra.
Hi, how are you, Matthew? Actually, this is the first time I invite someone. We are always doing some IG lives, but I am always invited, so I'm
Well,
very
well,
happy.
it's worked out fine, and yeah, we're connected. That's great.
Yeah. How are you?
Yeah, very well. How are you?
I am fine, thank you.
I take it it's quite late there, and I appreciate you inviting me on to chat.
The same for accepting it because I this year maybe you already follow our IG lives, and this year I concentrate on making as many as of the IG lives to make a community, hair care community with SMP studios and barber shops and hair transplant. Actually, we are a very strong community if we can come together.
Absolutely. And it was something that I was thinking about a year ago, but I had no way of really approaching any clinics out there in Turkey. Maybe the language barrier, possibility that they may not want to work with me, but I'm really happy that you reached out to me and we were on the same page, because I've been looking for a solution to introduce people to hair transplants and being able to offer them a unified solution. So this is a great opportunity for me. Thank you very much.
Perfect. I am very happy to hear that we are at the same point of it. And actually, I believe that you are right. You already know lots about Turkey. The language barrier may
Yeah, yeah, yeah.
I don't know why actually people talk with patients, with clients a lot in different languages, but communicating, if it is not business, chatting is a little bit, um, they hesitate on communicating more, I believe.
Yes, but I've been out to Turkey myself and I've already had my teeth done. And yeah, I was worried about what would I be able to communicate with them, but it was fine. And the whole process was as smooth as anything. So I was really pleased that it all went really well. And I've been obviously an advocate of people going there. And, and on that basis, it gives me confidence to send people to you for hair transplants. And today was all about announcing our partnership, me introducing a brand new service, a unified hair loss solution, hair transplant plus SMP, everything taken care of, the whole journey, start to finish. And I think it's a brilliant solution, and I'm looking forward to offering it to my clients.
Thank you very much for being that visionary and for sharing this vision, Matthew. And maybe we can talk about if anybody don't have any questions, we can talk first about hair transplant details. If you have any questions, I can answer them.
Absolutely. I mean, there's a bunch of questions that I have, and I'm kind of on the fence from a client's perspective. All these questions that I'm asking you, I already know the answers to, but I would like, for us to discuss it live, and then anybody who's watching it back later on, they can get the answers to the questions that they need to know. And I think the main question is, when does somebody take the plunge? When is it right for them to actually have a hair transplant? At what stage of hair loss is it the best time to take the plunge?
Oh, okay. It's a very the basic question is how to decide the right time. But I always say that hair loss is not a disease, and hair treatments, including hair transplant and SMP, we are not doing medical treatments. So people choose to have them.
That's
So
right. Yeah, it's elected rather than required.
it's,
I understand that.
uh,
It's the same with exactly the same with SMP.
yeah, yeah.
SMP
So,
isn't for everybody.
uh,
Some people are happy.
yes.
They grow old gracefully. It's fine by them. Some people want to kind of reclaim a little bit of their youth, and having a hairline certainly does that, frames the face and gives the appearance of a more youthful look. And I'm a great advocate for SMP, hence why I started my business here in Northampton, offering SMP to people who are really just fed up of being bald, effectively. So, and it's been a success.
Which is very normal, you know.
Of course,
No right or wrong. It is all about how they feel about it. If we want to feel better, we want to feel young, we want to feel appreciated, and first we want to give the impression to ourselves when we look at the mirror. So if you are happy with your look when you look at the mirror, however you look, it is all okay, because it is not a health issue. But if something wrong, if you feel disappointed, or if you think that something additional would be very good for you, for your feelings, the right time actually. But of course, scientifically, we have a Norwood scale which shows the degree of the hair loss, and it goes from 1 to 7, and the 7 is the most severe hair loss stage, and mostly people come to us for hair transplant after 3 and before 7 and 6.
sure,
Between 3 to 5, or clients come to Turkey come to us for hair transplant. But I personally believe that at all stages, we guide them very carefully, and this SMP gives the supports the results. Both procedures supports the results of each other, and if we combine these two procedures, we can cover almost 80% of the scale.
yeah, yeah. When I've treated clients that have had
from earlier stage, and because if someone has, especially for male pattern, if someone has a donor hair capacity, we don't actually, it is not important how big their bald area on the scalp. If we combine it with SMP, we can give more of the hair feeling, hair look, and because it is all about the density. But
absolutely, yeah. Absolutely. I get that. I mean, my clients come to me and yeah, they've had successful hair transplants and yeah, it looks great. However, they feel that it's maybe they just need a little bit extra density, a little bit of what we call here hair density. And then once the 3 sessions are over, they seem to have they almost feel that they've had more grafts. They think that they've had more grafts, even though they haven't. It's just an illusion. Okay, so, and yes, it looks amazing, and it's a perfect combination. So yeah, I'm really happy to now be on the side where I can offer the hair transplant and SMP as a unified solution. And okay, it's going to take about a year for the transformation to be complete, but it's worth it. I think for the results, it's definitely worth waiting and going through the process to achieve the look that you want. So yeah, it's definitely worth it. The other thing I was going to ask you, if you've had SMP first, can you go and have a transplant after? Because a lot of people do it the other way around. They have a transplant first and then get the SMP after. Is that possible? All depends on the donor area, I take it. Yeah.
Um,
And also
it is
whether if they stabilized their hair loss, which is
yeah,
another.
yeah, of course, if they stabilize. But actually, there's still a margin for that statement too, because it it is the same for all the aesthetic surgeries, aesthetic treatments, because I may decide to, because females, women at ages 20s, at their 20s, get some procedures done. So you can prefer to have it done before your hair loss stops, and you think that I will enjoy this period with. That's all about the personal decision. Okay, it's the same for the hair loss treatments, for both hair transplant and SMP too, and we can, of course, someone already have SMP can have hair transplant.
Good.
Let's first.
As long as they've got enough donor hair to support, and then that's the crux of it, really, I suppose.
Yes, but if before having any of the surgeries, we advise having the hair transplant first, earliest 10 months later, and possibly 1 year later, having the SMP.
Sure.
Why?
Yeah.
Because hair transplant is an invasive procedure. We do some cuts on the scalp, we open channels, and there is a period of healing after the hair transplant, and it takes the deep tissue takes at least 10 months to recover.
I know.
If they have SMP before, that healing process, that period may fade the color of the SMP, while regenerating, while recovering the deep tissue. So, and also, this is the first reason. And the second reason is, of course, our success rate is around 95%, okay, for hair transplant. But it all depends on the scalp, and it is very personal. Results are also personal. And you will see the end result of hair transplant, and the SMP studio will give the density after hair transplant by making a harmonious look.
Yeah, no, that's great. So they'll be coming back to me for maybe some more density post hair transplant,
and also
due to the healing.
Also, the third one is, especially in US, because we have a US market too, a big market there. We have many valuable SMP collaborating studios there, and in US they mostly do hair transplant clinics, still do FUT, and it leaves a big scar. But in Turkey, for last 10 years, we don't do FUT. We only do FUE and DHI. And FUE and DHI, the extraction methods are the same. And we extract the grafts one by one from the back. So we don't leave big scars, but we still leave some small spots on the back, on the donor area. If they get it done, the SMP, after the hair transplant, the procedure will be a whole procedure that will cover both the donor area spots and giving the density to the hair transplant results.
That's exactly what I was going to lead on to, because it isn't just adding density, it is covering up some of those small puncture wounds, especially nowadays with gentlemen having their hair super short at the sides. It's a passion. So where, a few years ago, they could possibly cover those small puncture marks by growing their hair out a little bit longer. But because of fashion and people keeping their hair super short, some people even having skin fades. So yeah, they're more exposed and they're showing those scars. SMP is amazing at covering those scars. And I've had clients tell me that they lived with their scars for many years without even knowing that SMP existed. And I've had clients come to me too early. Now they've been told that they need an SMP by their surgeon, but the surgeon hasn't said to them they have to wait. So they're super keen to get in to the clinic here, but they're too early. They haven't allowed enough time for the healing. The scar tissue needs to fully heal before any pigment can be implanted due to um, adverse reactions or something could. We need the scar to be fully healed before we can definitely implant any pigment there.
Yeah. And
So there is a wait for them, which is sometimes frustrating, but it just has to be done.
as you told, I advise men to think this a transformation period of 1 year for themselves. They can spare this time for themselves for a transformation because it takes time,
Done
and
properly. Yeah,
but at the end of that 1 year, their look will really change. Because the front hairline makes the difference. If you have a front hairline, you are not bald.
exactly.
By
Yes.
means by SMP with small dots or with a 3D hair graft by hair transplant, but with a front hairline, which is the most important part of both of our jobs, works, the results, you are already not bald.
Absolutely. So, in terms of, would you say that a hair transplant is the last chance saloon for anybody who's suffering with hair loss? They might have tried derma rollers, PRP, mesotherapy, laser light caps. They tried shampoos, pills, and all sorts of solutions to try and stop their hair loss, slow it down. Eventually, they say they give up, I'm going to have a hair transplant. I think it might be the last chance saloon for these guys. And a lot of them don't even know about SMP anyway. So, me offering a combined treatment educates people that they can achieve a fuller look, even if it is their last chance saloon. So, it's not all doom and gloom. That's the good thing. It's not all doom and gloom.
Uh,
You you can revive your look, the look that you want. You just got to wait a year for it.
uh, First, I believe that they don't have to wait for anything, but choosing the types of treatments is all about how you look at life. Okay, personally, I am. Of course, you can get medicines. You can get also you can use different shampoos, and you can get some oils. You can use derma rollers. You can use, but it takes longer time,
Well,
and it especially for male pattern baldness, it really differs very little, and it doesn't worth your effort to make it better, I believe.
yeah, yeah,
So
yeah.
that's my opinion, but it may change. uh, they that's not wrong or right. That's an idea, that's a way of looking at a situation. I believe that uh, if you have a male pattern, hair loss, hair transplant, and forgiving density, SMP is the ultimate solution. Even you may choose it at the beginning or after
Yeah,
some
yeah.
stages, but you don't have to wait. You can repeat both procedures, hair transplant and also SMP. Of course, it is all about finance. I don't want to say anything wrong because, there is a trend always criticizing each other's way of thinking. But I respect anybody's feeling about having these procedures. But in my opinion, having when you feel bad about your look, that is the right time if you have donor hair.
Yes, of course. Yeah, yeah.
Of course, you need to wait until the hair loss stops, or at least you lose hair at least 5 years.
Yeah,
After a stage of no root scale, at least you need to wait. But I am not sure about these trends, because people making po getting popularity by criticizing some industries. But we just answer questions and we take it very serious, or we take our job very serious, and we take care of every details about the health issues. It is the most important thing, you know. But if there is no problem about their health, the right time is the time when the client wants to have it.
exactly. And that leads me on actually to contraindications. Who can't have a hair transplant, for example, due to their medical condition? What condition would you say would stop them from having, if they had scalp problems, would you say go to to go get those scalp issues
Yes,
resolved beforehand?
yes,
Yeah,
yes.
a
If they have that
trichologist.
psychological problems, that should be treated first, of course, because you know we first do video consultation with the clients, and we take the pictures, we do video consultations, we
Bringing that
get the picture, and we discuss it with our team. If we discuss and review the and health history with our team, and we decide if he can get the hair transplant with their health issues, or if they need to go any other like dermatologist, or we generally, if over uh, age, we ask for the cardiological consultation, because or we can or um, hair transplant decision, uh, either FUE or a DHI, because we use less medicine for DHI. So we prefer the system we use for that patient. We decide by the history of the health history of the
of
client, and with the pictures and video consultation.
course.
We we we,
But it,
we don't do anybody, because the most important health issue for this procedure, health hair transplant, is diabetes. We still do mostly with DHI, but you know, I told the 95% success rate we have. But diabetes, since it decreases the healing process and results, the success rates, we tell at the beginning to the client that the success rates go back to 75%, 70% or less. But we still wait until their the levels diabetes
safe to do
symptoms.
so. Yeah. So really, it's about setting the client's expectations and then exceeding them if possible. So obviously, that's great. Yeah, no, that's really good. Other thing I was going to ask you actually, let me just have a look at my questions here. So, what method do you feel is more effective? As in, we're hearing an awful lot here in the UK about DHI, and it's being hailed as a brand new solution or some new magical way of extracting the hair. Now, you know, I can't see much difference between the two, FUE and
I
DHI.
will tell you now.
But yeah, it's, a lot of marketers here in the UK are using that term to make out that it's a brand new solution, and you can only get it here in this clinic. You know, but when you ads on Instagram, for
Yeah,
example. And UK clinics?
First, we do both FUE and DHI. We prefer each method for different clients and for the preference of the client's expectations.
Brilliant.
But the difference between these both methods, they are the same extraction way. We extract the follicles, hair grafts from the donor area exactly the same way. One by from the donor area, and with micro motors that we have very small tools that extract the hair grafts in healthy conditions. That it is the same.
Good.
The difference between FUE and DHI, for FUE, we do first, we open channels with we use at our clinic. The best thing is sapphire, because they are sharper and they make smaller incisions, and we can it heals better. So we use sapphire blades, but we open channels and then put the grafts on that channels.
Yeah, yeah.
DHI, the difference is we don't open channels. We have special pens. We put the grafts in that pens, and that pens have a small channel on it, and we push like a pen. And we call it koi pen, and we put directly to the scalp the hair graft.
Great.
What is the difference? Since we don't open channels, we can make more denser.
Sure.
Okay. And also, if the clients have a fully bald area, we don't have to shave that area special to that. We always prefer full shaving because of the hygiene rules. Okay, we advise it, but if they insist on not having the whole shave,
Reduce
yes, we use, if they only have fully clear bald area of hair transplant, we use the HI. But since we have to use more grafts for the transplant at the HI, for the HI, yes. If we have a big bald area, we prefer FUE.
Sure, yes. To spread it out more evenly.
Yeah.
Yes, I get that. That makes total sense. Now, excuse me, in terms of the process, now, how long are they actually visiting your surgery there in Turkey? So what's the round trip? How many days are they out there? And really, is it like a 7-day trip or 2 weeks?
Okay.
What's the length of the treatment?
It's a 3-day trip.
Perfect.
But hair transplant itself is only 1 day. Okay, in the morning they come to hospital, and we just make the blood test, and if we need any other consultation, we plan together again by physical consultation with the client. We decide the front line, also the shape, and which area we will use, how many grafts, and we again physically examine the donor area, the capacity, and then we start. And the hair transplant takes 6 to 8 hours. But we give local anesthesia, and they are awake. They can do anything they want. They can look at their phones, have television. They can watch anything. They can have coffee breaks, also lunch break. It's a comfortable day, and they don't since we do anesthesia, we don't they don't feel anything actually. Of course, since they are awake, it may be not that comfortable feeling, but physically they don't feel the pain. And if mentally they don't feel comfortable, we also can give some medication during the operation, just to make them calmer.
Sure. Almost like a twilight sedation. They're
Yes,
still awake, you can still hear you, but they're a lot more
yes,
relaxed. Yeah, yeah,
yes. At the end of the day, we take them to the hospital, hotel. The next day, they just rest at the hotel. The second day, the third day, in the morning, we take them to the hospital. We do the first washing, and we teach the client, we teach the patient how to wash, because the first 10 days are very critical for the hair transplant success, because they are not already settled at their new places. So you don't touch it, you don't itch it, but you take care. And the first 10 days, for the crusting to go away, they need to wash with special shampoo, and with a special technique we show them. And
yeah.
also we share the videos with them. And the first 10 days, every day we contact the clients if they need anything,
Yeah,
if they don't
yeah.
ask it. And after the first 10 days, they already get the crust away. Each month, we contact them and get the pictures. And
Progress.
of course,
Progress.
in between, they can contact us if they want. But even they don't contact us, we contact them regularly during the first year.
Wow, that's really good. Yeah, that's really good. And I'm sure that the individual that's having the treatment, they're very aware of how delicate it is in those first 10 days or 2 weeks or so. And I'm sure that they are following the rules. Otherwise, it wouldn't be successful, especially at 95%. So, yeah, they must be definitely doing what they should be doing. That's for sure.
Yes, but they can get scared, or they can worry very quickly, and they want to contact, and if they cannot reach you, they feel bad.
Sure.
Uh, it is the first 10 days is very important for
Crucial.
uh,
Yeah.
health and result.
And if an individual wanted to stay out in Turkey for the duration and they were just going to be paying for their own
Mhm.
accommodation, they could potentially extend their trip. I know that you offer the 3 days and you offer a complete package,
Mhm.
all-inclusive
Yeah.
package. But if they were worried and they felt that they didn't want to travel home for fear of complications, would they be able to stay extra time in that hotel if they were willing to pay for it
Yeah,
themselves?
of course, we can arrange for them, or
Or move
but
to another local hotel? Yeah, yeah.
but actually, most of our patients first have their vacation, and last 3 days they come to us and they fly home. They prefer, because since you
Yeah.
already, Turkey
And, and
is
the clinic,
very lovely, and Turkey is a very historical, and vacation. It's very good for vacation. The
absolutely,
sea and
yes. And the weather. Yeah, yeah.
place.
Yeah, I've been out there many times and I love it. Absolutely. I'm looking forward to going back out there soon. However, I've never been to Istanbul before, so that's something that's on my bucket list to do. So if I do and I come out there, I'm definitely going to be coming and visiting you there.
Yes, of course, please.
Brilliant. So to sum it up then, really, so what will happen here at Heading is that I would be their patient coordinator. Queries would come through to me. You know, I offer other services to people who may be suffering from hair loss, and it's a no judgment place heading here. You can come here and discuss hair loss. You don't need to want SMP. You can come here with a scalp condition. I can advise. You can come here and discuss wearing a hair system, and I can advise, and I can also refer to professionals here in the UK that I work with. So having you on board for hair transplants only bolsters my hair loss solution clinic, you know, to offer multiple options for people. So I'm looking forward to working with you and looking forward to having a long, prosperous partnership. So, and I'm yeah, I'm really, really happy that we're working together now.
I am very really happy first to know you, to meet you. Thank you for your kind words and for making this evening possible, Matthew. I'm very pleased to meet you first, and of course, the this I am very excited to see our collaborations results. And I just want to make it clear, you just don't need to explain to the clients anything. You can just give them my contact or give me their contacts,
Yeah,
and
absolutely.
you already know how to take the pictures. You can take the pictures and share it with me. And also for some other partnerships, they just call me with video call, and they just give the phone to the client and we make the consultation.
Absolutely. No, I will be doing that. That's for sure. I'll be advising anybody here that to learn more, I will definitely be putting them through to you as the experts there in Turkey. So that's no problem at all. Yes.
And also, I would like you, if you have that kind of community there. You know, barbershops are also a part of our community. You can make your own community there.
That's right. That that's
The
that's
barbershop also the first contacts, and most people go there each month.
exactly
None of us see the client directly, face by face, with that
yeah,
frequency. So if you can make that kind of community that will be streaming the clients to you, it will work very successfully.
exactly. And from today onwards, I'm already working on my marketing and branding and including the service that you offer on my website. So yeah, it's going to be exciting to branch out and do that. Yeah.
Okay, thank you very much.
Well, have a good evening the rest of the night. I know it's probably straight to bed for you right now, but I really appreciate you joining me
Thank
and inviting
you.
me on. And I look forward to speaking to you very soon. And in the meantime, just for the guys watching or anyone else watching after, if you're interested, hit me up on my DMs and we can discuss further about taking it forward with Semra and She-Wolf Medical in Turkey, Istanbul, the home of hair loss. So yeah, I'm really excited. So if anyone's got any problems, any questions or anything that they want to discuss with me and you, let's reach out to us.
Yes, I hope I will. I can record this.
Absolutely. When you hit close
Okay.
on the live, it will ask you to save and it will save it for you, okay? All right.
Okay. Bye. Bye.
Take care. Take care. Bye bye
Bye
now.
bye.
Bye.